Most brain MRG FOSS implementations only require about one or a handful of thick slices about every 3 seconds, making volumetric thermometry very elusive. This limitation primarily arises from a number of constraints, namely, if we want to increase our frame rate or acquire images more quickly, we typically need to sacrifice either our voxel size or our volume coverage. So in this talk, I present a new pulse sequence for increasing volume coverage using a golden angle stack of stars 3D EPI pulse sequence. So here's a trajectory of our 3D stack of stars EPI sequence. So in the through plane, or the phase encode direction, we acquire a number of EPI slices every TR located at one radial spoke in plane. And successive TRs are angled by the golden angle, and I emphasize here that the golden angle radial ordering gives us a flexible retrospective reconstruction from any contiguous set of these radial spokes, which permits us to have a flexible frame rate for MR thermometry. And also, it permits us to use sliding window reconstruction at any point during the MRG FOSS sonication, ensuring that we don't miss the peak heat. So this is our workflow of our temperature reconstruction. So a contiguous set of our radial spokes is put into a 3D stack of stars K-space. We first perform an IDFT in the slice dimension. So this resolves our slices, the slices of our volume in the slice dimension, giving us a set of K-spaces, which we can put for further processing into any temperature reconstruction scheme. And in this talk, I'll be focusing on a talk that our lab previously published called a K-space hybrid technique, which is basically a constrained temperature reconstruction technique which permits higher acceleration that would be possible with other acceleration techniques like parallel imaging. So moving on to results, we first computed the temperature precision at a number of different acceleration factors. So we're basically looking at different frame rates. So looking at the current clinical standard of about 3 seconds per volume per frame, this is 64 radial spokes. We see that the temperature precision of our K-space hybrid technique, so this is our constrained temperature reconstruction technique, has a very similar temperature precision to that of the standard temperature reconstruction over here. And importantly, as we want to increase our acceleration factor or go to higher frame rates up to about 380 milliseconds per volume per frame, we get a much lower temperature precision, a much better temperature precision using our constrained reconstruction technique compared to the standard temperature reconstruction technique. I emphasize here there was no sonication done in this experiment. We are just looking at temperature precision in the brain, and we are able to get whole brain volume coverage of about 11.9 centimeters in the foot head dimension and 43 slices for temperature monitoring. We then computed the temperature precision in our 3D sequence and compared that to the 2D sequence. So this is just a standard 2D spoil GRE sequence. We did this in 5 different subjects, and we see that the temperature precision was slightly lower than that of the 3D sequence. And again, the trade-off here being that the 3D sequence is giving us whole brain volume coverage with 43 slices for temperature monitoring. The bandwidth of the 3D sequence is slightly lower than that of the 2D sequence, owing to the relatively longer readout time of the EPI echo train. And on the subject of lower bandwidths, EPI pulse sequences are known to be sensitive to off-resonance distortions, particularly at air tissue interfaces like at the sinuses. However, we can minimize those off-resonance distortions by shortening the echo train, so going to 2 shots and 3 shots, and we can see that those distortions become minimized at higher shots. And importantly, at higher areas of the brain, particularly in areas like the thalamus, we can see that at any multi-shot factor, there are no off-resonance distortions. And our last results, so we performed a sonication in a tissue-mimicking gel phantom using the Philips-Sonolive clinical MRG FOSS system. So what I want to emphasize here is that we can start to move away from single-slice temperature reconstructions and move towards more advanced volumetric visualization techniques like the MIP technique or the maximum intensity projection technique, which basically allows us to look at temperature changes in a 3D volume in 3 different dimensions all at once. And again, that's 11.9 centimeters of volume coverage and 43 slices for temperature monitoring. And just in conclusion, our 3D stack of stars EPI readout permits high-resolution MR thermometry with either a standard sense reconstruction or case-based hybrid temperature reconstruction or constrained temperature reconstruction technique. The golden angle radial ordering is what enables a flexible adjustment of either the frame rate or a sliding window reconstruction. So for example, we can go back and retrospectively reconstruct these slices at any desired frame rate for instance, doing higher frame rates for focus monitoring or lower frame rates for near or far field safety monitoring. And importantly, the sliding window reconstruction ensures that we will not miss the peak heat. Also, the EPI slice sampling enables a flexible adjustment of volume coverage. So again, we can acquire more slices where we care more about monitoring the focus. And I addressed this a bit before, the low pixel bandwidth in the slice dimension. One way we can mitigate that is by going to higher multi-shot factors. And our group has also published another technique for performing a chemical shift correction to compensate for that. And with that, we'd like to thank our funding sources and, of course, the Focus Ultrasound Foundation for having us.